In January of 2011, the Indian Hill Exempted Village School District established a food allergy task force to gather information about managing food allergies in the school setting. This led to the development of a food allergy policy, which was approved by the board in the summer of 2011 and presented to the entire staff in each district building in August of that year. Policy can only be effective if the entire staff is aware of what a food allergy is, what the most common food allergens are, the signs and symptoms of a reaction, the medications used to treat a reaction, and the specifics of our own policy, including age and building appropriate strategies and necessary documentation. The safety of a number of our students, the peace of mind of their parents, and the integrity of our schools are the reasons for the policy and its provisions. This PowerPoint information about the health threat of food allergies and what we need to do to minimize the risk of exposure. Familiarizing the staff about the policy, the emergency response procedures, including individual health care plans and allergy action plans, and information about how to implement the plan are all part of this PowerPoint. As you can see from this slide, approximately 12 million Americans suffer from food allergies, and between 150 and 200 people die from anaphylaxis to food. Anaphylaxis is a sudden, severe, and possibly deadly reaction that shuts down one or more of our body organ systems, resulting, as I said, in possible death. 2 million school-age children have food allergies. Some CDC studies indicate the number could be rising and result in a prevalence rate as high as 18% of children under 18. In our own district, recent kindergarten registrations indicate up to 8% of the students have a food allergy. Some students don't have physician's orders or medications to deal with this issue. Some may not even fully recognize the seriousness of their own allergy. You could be the vital link to ensure their safety at school. Your time is valuable, and there is always information to learn and review. We respect that, thus the reason for this video. Though you are required to view and review this information, the video gives you the opportunity to get the information at a time that is convenient for you. To begin with, what is a food allergy? It's a health problem characterized by the overreaction of the immune system to a specific food protein. The reaction is defined as a food allergy through a blood test, a skin test, or challenging the patient's immune system by introducing the food and watching for a reaction. This is always done in a doctor's office. Our own policy requires that we receive a doctor's verification of the diagnosis of a food allergy. If a parent identifies their child as having a food allergy by phone, a meeting, or on the emergency medical form, the nurse in each building will advise the parent that a doctor's note needs to be on file. You will be notified of every student you have who has met this requirement. The most common food allergens are milk, eggs, peanuts, tree nuts, fish, shellfish, wheat, and soy. But any food can be potentially a problem for someone. And the reactions vary from mild to deadly and affect a number of our organ systems. It's important to know that no two people react the same way to a food allergen, and every reaction for a particular person can be different from a previous one. Probably the most easily recognized reaction is the skin reaction. Red, itchy, swollen areas called hives often appear within minutes of exposure to an allergen. Flushing, tingling, itching of the mouth, and paleness can also occur. Please note that younger children may say their food tastes funny or spicy. their voice may sound scratchy, or they say their clothes feel tight. The digestive system can also be affected. Cramps, nausea, vomiting, diarrhea, and difficulty swallowing can occur. Reactions from invasion of the respiratory system include itchy eyes and throat, coughing, shortness of breath, chest tightness, and wheezing. Though not as common as other allergic responses, the cardiac system can also be affected. Low blood pressure and increased heart rate stemming from shock can result in a loss of consciousness. These symptoms usually appear later in the immune response, but obviously loss of consciousness would be an emergency situation. Often unrecognized are the symptoms related to the neurological system. If an allergy student has a sense of doom, anxiety, or lightheadedness, and has possibly been exposed to a food allergen, recognize these as possible side effects of an allergic reaction and seek immediate evaluation. Remember, no matter what system is involved, the reaction can occur within minutes up to hours. Always react as soon as symptoms appear. Epinephrine, or commonly known as the EpiPen, is the only medication that can reverse an anaphylactic allergic reaction. The only medication that can reverse an allergic reaction. Epinephrine is the hormone adrenaline, and it treats anaphylaxis by relaxing the muscles around the airway and increases the heart rate and blood pressure to prevent shock and improve oxygen distribution. It is important that you know how to use an EpiPen. Many students carry their own EpiPens, and though they are trained to use them, they may be frightened or hesitant to actually stick themselves, and you may need to do it. You may also be required to carry one on a field trip. Here is a brief video demonstrating the use of an EpiPen.
I'm allergic to nuts.
I can eat strawberries.
Milk doesn't like me. Mommy says I got an allergy.
I get all red and bumpy. My eyes get puffy like this.
I don't breathe so good. My tongue gets itchy.
It made me really scared.
This
is my
EpiPen.
EpiPen.
My EpiPen.
Take it out of the case and pop off the cap.
Make a fist like this.
Like this. Kids like me to sit on laps.
Bigger kids sit or lie down. Here's a spot, just hold my leg still. Press, click, and hold.
Be sure to hear the click.
Hold it there for 10 seconds. That's 10 seconds.
Always have an extra EpiPen ready because the medicine can wear off.
Then call 911.
Easy, white.
Today, doctors are seeing more and more children with allergies, especially food allergies. In a room of 20 kids, one or more of them will have allergies. While most allergic reactions result in merely uncomfortable symptoms, some anaphylactic reactions may be more serious and even life-threatening. About 150 children and young adults die from food allergies every year in the United States. Due to the unpredictable nature of allergic reactions, over 2.4 million epinephrine autoinjectors, such as this, are currently being prescribed. EpiPens deliver medicine quickly and effectively, but they only work if there is somebody around who knows where the pen is, when to use it, how to use it, and will actually do it. Times when you need to use an EpiPen can be stressful and may even be life-threatening. So it is important to have a plan of action so you can calmly react to the situation. Knowing when to use an EpiPen can be easy. If a child eats something they're allergic to, has hives, and is wheezing, give the shot. Sometimes, however, symptoms may not be as obvious. So if you are in doubt, always give the shot. You may not even have known what the child has eaten. But if you do suspect an allergic reaction, or a child is demonstrating 2 or more symptoms, don't wait. The longer you wait to administer an EpiPen, the harder it is to stop an allergic reaction, mild or severe. And allergic reactions can change from mild to fatal quickly. No child has ever died or has had serious problems from a standard dose of epinephrine. To protect the child in your life, be prepared. Memorize these steps and practice them. Review each child's action plan. Know where each child's EpiPen is. Locate it. Epi equals 911. If you get it, call it. Take the EpiPen out of its case. Hold it in a firm fist grip. Remove the cap. Make sure the child is sitting or lying down. Identify the big muscle in the thigh. Hold the leg and the child steadily. Press the orange part firmly against the thigh so that it clicks. Stay there. Don't bounce. Hold for 10 seconds. Press, click, and hold. Some of you may have an epinephrine injector that looks like this. This training device has yellow caps, but yours may have a different color. This has the same medicine as the EpiPen, the same kind of spring-loaded needle, and is used for exactly the same reasons. This injector has 2 safety caps. Hold the injector in a fist grip. Don't put your thumb on either end. Remove both safety caps. The red end is the action end. That's where the needle comes out. Remember, red to the leg. The red end should not touch anything else. Again, make sure the child is sitting or lying down and hold for 10 seconds. For this device, the needle will remain exposed after use. Please put it down carefully or put it back in the case. And if you haven't done so already, call 911. As with any emergency medication or device, please be familiar with it before you need to use it.
Anyone who has an allergic reaction and receives EpiPen administration must be taken to the hospital by an ambulance. Epinephrine only works for about 20 minutes, so the patient needs to be observed in a hospital setting where additional support such as fluids and oxygen are available. Oftentimes, second doses are required. Always give the used EpiPen to an EMT transporting the patient to the hospital. This will affirm that the medication has been given. Other medications such as antihistamines and inhalers can be used to treat mild allergic reactions such as itchy and runny noses, but they do not stop an anaphylactic reaction. Some doctor's orders may include using antihistamines such as Benadryl, Claritin, Zyrtec, or Allegra after a mild reaction. Some students are prescribed inhalers to use at the first sign of an allergic reaction. No matter how mild the reaction, all students who appear to be having a reaction must be sent to the clinic immediately in the company of someone else. A brief evaluation will determine if a prescribed drug of any kind will be administered. Please note, if a child is having a serious reaction, call the nurse to meet you and the child at your location. If the child carries the EpiPen, don't hesitate to give the medication while waiting. You cannot harm the child. It's important to know that epinephrine should never be kept in a car or refrigerator. It should always be at room temperature. EpiPens are clearly labeled with the child's name, dose, and expiration date. Some children will carry the medication while others will have their EpiPens in easily accessible but secure places such as the clinic. You will have documentation of what students have EpiPens and where they are. All of this information is important. Now you need to know how to put it into play under the provisions of our food policy. After a food allergy student has been identified, the building nurse will discuss the situation with the parents and document the child's condition. History of exposures and reactions, what medications they are prescribed, and other health-related matters are included. Occasionally, the parents may want to include their child's counselor or teachers in the discussion. The nurse will arrange the meeting. After all of the information necessary is gathered, an individual health care plan for the management of the allergy will be developed. Some students may also have a 504 plan to manage their allergies. The care plan will include The doctor's documentation of the food allergy, an order for epinephrine as well as other medications necessary, the parents' names, phone numbers, and signed consent to administer all medications, as well as consent to share information with the appropriate school staff. A request will be made for at least 2 EpiPens per student. Location of the medications will be included. A school management plan which includes a description of the student's past reactions, including triggers and warning signs, a description of the child's emotional response to the condition, as well as the student's physician information and emergency contacts, and documentation if the child carries his or her own medication will be included. Also included are instructions for the teachers, room parents, and subs provided in an allergy action plan. 2 copies of the Allergy Action Plan printed on green paper will be distributed to each teacher, 1 copy for themselves and 1 for the subfolder. In addition, the bus drivers and the cafeteria personnel will get copies. The action plan will include the child's name, their picture, their allergy, date of birth, and if they also suffer from asthma. The specific actions to be taken if there is an exposure to the allergen will be detailed on the form. Additional relevant information for a particular student, food restrictions in the classroom, and where the child's medication is stored are all included on the action form. Each form will be signed by the nurse in each building. You will receive these forms before the first day of school and at the semester change as needed. In addition, the entire staff will receive a list of all students in the building with a food allergy, their grade, their food allergen, and what medications they have on hand. This information is confidential and not to be shared with anyone. If you have questions, contact your building nurse. The emergency response plan is printed on the back of every action form. This plan includes what to do, who to call, where to go, and follow-up procedures. Please read it and be aware of the actions that are part of the plan so that you can respond immediately. Remember, there is no cure for food allergies. Our policy was designed to minimize exposure to the food and therefore prevent a reaction. Think ahead. Food event planning forms and curriculum planning guides are available in each building and must be filled out by each staff member when food is planned for an activity. Restrictions may occur due to specific allergens of students in the building or classroom. Read labels before considering a food for an event. List the ingredients on the planning forms. Wash hands and clean areas where food is present to prevent cross-contamination. All of these things are in place to ensure the safety of all of our students. Only if everyone participates will they truly be safe. Please make sure you have a copy of the District Managing Food Allergies in School policy. Contact your building nurse if you need one. Now to discuss the expectations and responsibilities defined in the food allergy policy, here is Dr. Antonio Shelton.
The staff in the Indian Hill School District is required to follow the food allergy policy as written. The expectations for food use in the schools are: students in kindergarten through grade 5 will be permitted healthy nut-free snacks including fruits, vegetables, and grains. In specific classrooms, snacks may be further restricted to ensure the safety of students with allergens or other chronic health issues. Snacks will be provided by parents. They should be in the original packaging, and the students are not permitted to share snacks. Students in grades 6 through 12 will be permitted to have snacks. Also, snacks may need to be restricted in certain areas and should be provided by parents. In addition, the staff will share food allergy awareness facts with their students at the beginning of the school year. Kindergarten through 5th grade parties will be limited to 4 parties a year: Halloween, winter, Valentine's Day, and end-of-the-year parties. Room parents are encouraged to bring in non-food items for sharing and to focus on activities and crafts that encourage team building. Food items must be pre-approved by the classroom teacher. Food items brought in are limited to one food item and one beverage organized by the room parents. The classroom teacher will communicate with the parents of food allergy students and the building nurse prior to approving the food items. Students in grades 6 through 12 will not have holiday parties at school. Student-created or impromptu parties using foods are discouraged. During kindergarten through 5 birthday parties or birthday celebrations, parents are permitted to bring in small, inexpensive, non-food items such as stickers or pencils for sharing. Students in grades 6 through 12 will not have birthday celebrations with food at school. Staff members are not permitted to use food or incentives or rewards. Items that provide positive reinforcement such as stickers, praise, encouragement, and other creative strategies should be used by the staff. Individual student behavior plans may indicate foods be offered as a reinforcement if other interventions prove ineffective. These foods must be allergen-free in accordance with the classroom list. Instructional use of food in the classroom must be pre-approved by the building principal through the use of the food curriculum form. Forms have been created as templates on the shared drive under 4-View Allergy. Must be filled out in advance of the event and given to the nurse for verification and signed approval. You will receive a copy of the approved form. School-sponsored activities such as bake sales or class events must also be pre-approved using the food event form. The same procedure as the curriculum form must be followed. Fill out the form a few days before the event, return it to the building nurse, and wait for approval from the principal. Staff may continue to eat lunch in the cafeteria or classroom, or have students eat lunch in the classroom. Precautions should be taken to ensure areas are clean of food to avoid cross-contamination to those who share the space. All stakeholders within the district have certain responsibilities regarding the food allergy policy. These responsibilities are outlined in the policy, and you must take time to review these tasks. To summarize, administrators must communicate the guidelines to the staff, enforce the food expectations, support faculty, staff, and parents in implementing the policy, ensure training for the entire staff, provide emergency communication devices, if needed, for activities that involve a student with a food allergy, communicate cleaning expectations with the custodial staff, oversee and approve food requests for curriculum, classroom, and school activities. The district nurse must keep up-to-date forms for the implementation of the policy in each building, provide feedback to the Director of Pupil Services and or the Assistant Superintendent regarding needed revisions to the policy, meet with the health specialist in the other building to discuss food allergy students, provide annual guidance regarding training and education for appropriate staff including administrators, bus drivers, aides, custodians, and subs. Prior to the first day of classes, confirm that 100% of the staff has been trained according to the policy guidelines. Every building nurse health specialist must identify each student with a food allergy and in collaboration with parents develop an individual health plan for the student. Prepare an allergy action plan and distribute it to all appropriate staff, including with it the emergency response plan. Compile a confidential list of all students with food allergies and share with the staff. Arrange a team meeting as needed with all staff who come in contact with students with food allergies prior to the opening school day to discuss the individual health plan. Encourage staff to review and training video on the food allergy policy and conduct individual training as needed. Meet with all food allergy students in the building, assess their knowledge of their condition, and familiarize them with the location of the clinic. Review and update the student's care plan annually. Classroom teachers and specialists must review and follow all the allergy action plans of any student in their classroom and keep a copy in the classroom and subfolder. Participate in a team meeting if necessary. Participate in training. Follow the emergency response plan outlined in the policy and on the back of the action plan. Be sure volunteers and classroom parents are aware of the food allergies in the room. Educate classmates about food allergies to avoid exposure, stigmatizing and harassing of the allergy student. Follow the food use expectations, including preparing the food curriculum and event forms. Work with the nurse to disseminate information to the parents of other classmates as needed. If the need should occur, participate with the planning for student reentry to school after an exposure. Never question or hesitate to act if a student reports signs of an allergic reaction. Enforce the approved snack list of foods allowed in the classroom. Prohibit sharing of food. Reinforce hand washing before and after eating. Complete the field trip form and submit it to the principal prior to planning a field trip. The food service manager must share all allergy action plans with all the cafeteria workers and make sure they are all trained in reading food labels and identifying food allergies. Review and follow sound food handling practices to avoid cross-contamination. Strictly follow cleaning protocols. Upon request, make appropriate substitution or modifications for meals served to food allergy students. The transportation director will ensure that training is provided on an annual basis to all school bus drivers on managing life-threatening food allergies, including EpiPen use. Follow and enforce the food use expectations. Provide functioning emergency communication devices on all buses. Maintain a policy of no food eating allowed on the buses and no food items given to the students by the drivers. The athletic director, coaches, and extracurricular moderators need to participate in any team meeting deemed necessary to learn how to implement the care plan for a particular student. Receive annual training regarding the food allergy policy and EpiPen use. Review and retain a copy of the allergy action plan for all participating students. Make certain that emergency communication devices are always present. Parents will be expected to inform the school health specialist or nurse of their child's allergies prior to the opening of school, and participate in team meetings as needed. Provide all the information needed for the care plan, including the food allergen, parents' names and addresses, phone numbers, emergency numbers, doctors' names and doctors' orders, child's past history, and other information needed to keep their child safe. Provide an uploaded EpiPen for the clinic as well as additional EpiPens for buses or self-carry purposes. Locations will be recorded in the action plan. Provide safe snacks for the classroom. Volunteer for field trips if possible. Teach their child all the aspects of their health condition, including what is, how to communicate clearly if they feel a reaction is starting, not to share food or drinks, carry and use their own medication, and take as much responsibility as possible for their safety. Students with food allergies must be encouraged to take on the responsibility to ensure lifelong safety. All of the forms mentioned in this PowerPoint are included in the Food Allergy Policy Appendix. Familiarize yourself with each document. Include in the forms are the curriculum and activity forms, which you are responsible for filing or filling out when food is being considered for an in-school event. As I stated, these forms are on the shared drive under For View Allergy. If you have any questions regarding the district food allergy policy, please contact the Director of People Services, Kathy Clark, the Director or District Nurse, your principal or building nurse. Thank you.